we have to be happy too. So our goal is to not cut everything out. It's really about how do we introduce them and have them in the regimen in a manageable way. And something very unique about our trials is that they are treatment-based. When you're developing an innovation such as digital medicine to treat patients, the team members you need, there's compliance, regulatory, reimbursement, trial design, engineer, clinician, nurse, pharmacist, and beyond. It really takes a keen understanding of how to prioritize what programs we're going to run. We also would benefit from understanding within the same individual, once the drug has been identified, at what dose should we give the drug at the right time? And the type of data needed for that is not a lot of data.
Today I'm joined by Dean Ho. He's the first Dean that I know, and one of the first scientific biohackers that I've also known who has a 21-inch biceps. He's obsessed with using AI to improve health outcomes for people. He's a director at the N1 Institute of Health, the director for the Institute of Digital Medicine, also known as Wisdom. So Dean, I'd like to welcome you to Front Row. You are building what Singapore, we call it the deep tech sector. You're really focusing on deep innovation in the health and biomedical space. But you yourself, you come from the US, which is actually already a very rich innovation ecosystem. So I wanted to ask you, what pushed you or what compelled you to come to Singapore to pursue R&D?
Something that we're really focused on is to really bridge innovation with validation, and then ultimately to take that validation and move it to people at scale, which will take a lot more expertise than just the technical side. We need to be able to interact with regulators, with policymakers, with insurers, etc. And I think one of the most unique attributes about the Singapore ecosystem is the accessibility and also the agility of all of these key stakeholders in one place at one time. Because the more time we can save with efficiency, right? After you come up with an idea, you validate and you move towards scaling, it's about saving lives at this point. Anytime you can save time, it's lives saved. And I think that is the ultimate measure of impact of work, and that's what brought us here.
From your personal experience, what is the difference between the health tech innovation ecosystem in the US, where you're from or where you were trained, and in Singapore, maybe in terms of the way you collaborate with people or the way you conduct R&D?
One of the coolest parts about being here is what I call the ability to operate in a non-chronological manner. I think in innovation, we often think of coming up with the idea and then testing it out in a lab. And then from the lab, maybe it can go to preclinical, then to clinical, if one is fortunate enough. And then one thinks after they've done enough clinical work, which can take years, then they should speak to the regulatory community. And then after that works out, if it's regulated, maybe you can talk to manufacturing, depending on the tech, all the way to policy, to economics, so on and so forth. But I think what's important to note is that in this space, because the timelines can potentially be long, whenever you have an ecosystem where everybody's kind of close by, the ability to operate non-chronologically means we can think ahead a little bit and have some of these earlier discussions with the payers or the reimbursement or insurance side, or to meet with regulators earlier as well. And we did that. Thanks to many of our colleagues here, we had a very clear picture early on of kind of the types of testing we would need, how to get these clinical trials launched. And I think that type of closeness within an ecosystem is very unique. Yes, Singapore might be geographically small, but I think the core advantage for innovation is in this space is for that contact between the stakeholders to happen efficiently. If we were to work with our regulators and set up meeting times, we're talking about a time scale of potentially even days to have some of these important upfront meetings. In other ecosystems, it could take months to years to have some of these discussions just because of that scale. And so when we can condense things into a time frame that is so actionable, technology can advance faster. Validation can happen in a more efficient manner. And as I mentioned, lives get saved this way. And I think when we measure the impact we want to make, trying to be as efficient as possible matters.
When you share that, it reminds me of how in Singapore, everything is kind of optimized to reduce like coordination costs. And that was also a key component in facilitating innovation. One of the things that I really found interesting about Wisdom, and you can share more a little bit more about what actually Wisdom does, is that you also have a very unique way towards team building. You have a very unique approach towards team building. For example, I remember one of your first hires was someone from insurance, right? So what is the case that you're making through your hiring process, and what traditional mold are you breaking?
It's a great question. First off, I owe everything that we've done as a team to the team. It's really a remarkable group to bring together, in the sense that you have these amazing creators and innovators, but at the same time, they approach what they do completely with trying to understand who the users are first, and then to innovate truly for the user or users after getting that understanding. And so for us, the first person we hired was Johan Sapinel, who hails from the reimbursement sector. And we get asked quite often, as an academic research institute, why bring in somebody from reimbursement, which one might think is much farther down the road. When we set off the vision for Wisdom, our goal was to make sure we could validate what we did and to define that impact as the number of patients on our trials. And something very unique about our trials is that they are treatment-based. When you're developing an innovation such as digital medicine to treat patients, the team members you need, there's compliance, regulatory, reimbursement, trial design, engineer, clinician, nurse, pharmacist, and beyond. It really takes a keen understanding of how to prioritize what programs we're going to run. We can't run 50 clinical programs because that's just too many. And it's unrealistic potentially to think that all 50 of them have a real chance of being sustainable in clinical workflows. And so having somebody like Johan on the team helps us really prioritize which programs to put forth first, because at the end of the day, patients don't often pay for the solutions that treat them. They're paid for by government or private insurance or a combination of both. And we need that insight, the ultimate check writer, which is the ultimate measure of adoption, to really help us assess which programs to move forward and maybe which ones to hold for a little bit. We operate non-chronologically. We need the mindset of the payer. We need the mindset of the patient, of the doctor, nurse, pharmacist, allied health, and beyond. And that's why our team also includes behavioral scientists, behavioral economists, because we really have to get to the heart of bridging technology with human behavior. Because when you meld those two together properly, you go from an idea to true adoption.
In a certain sense, you're kind of breaking the traditional assumption that the clinical R&D and commercialization are two separate workflows. You're melding them into one. And what has been the experience like for you trying to bridge that gap? Has it been difficult for you to try to adopt a much more, as you said, non-chronological method towards project management?
In the beginning, I wouldn't say it was hard. I think it was actually a challenge in design of a group. And I owe it, again, entirely to our team, because this team really went into this with a truly open mind. I think it's not every day that we approach a graduate student and tell them that their work will involve making a recommendation. And that recommendation is not to give a mouse or an animal model a treatment, but it's to an actual patient. And I think that we're very open with our prospective team members that this will be part of your daily workflow. Are you okay with this? And I think our team members really approach this with an open mind, not just technology centric, but whole of ecosystem focused. We have this saying in our team that technology alone does not transform healthcare. And our experience has shown that to be very true. To really kind of build this hybrid of technology, regulation, implementation, potential commercialization and de-risking was a bit different, but the open-mindedness of the team is really reflected in the outcomes, right? We're talking about patients who at unconventional dosing, but safe dosing, have achieved favorable clinical outcomes. This is not a theoretical exercise. Our work is entirely prospective, which means we're not, theoreticizing that something may work based on old data. Everything we do is prospective. It means tomorrow. It's us taking a recommendation, confirming it's all safe and good to go, and affecting real world treatment tomorrow. That takes open-mindedness, takes grit, it takes being bold, it takes really a modernized way of viewing research. And that's what we have with this amazing team that we have.
It's interesting that you are really focusing on bringing medicine into tomorrow. And one of the things that you're looking at is experimentation using AI in personalizing medicine. So in the past, I guess the conventional treatment towards medicine is that you have some form of big data, population data, and then you derive treatments from it. But in your team's work, you're looking at what I think you call dynamic regulation on. So I wanted to ask you, what does that actually mean? And how are you actually personalizing medicine for the specific patient?
Something important to note is that there's so much excitement in the fields of precision and personalized medicine, and there's different ways to define both. I'll start off by saying big data is still very important, and we have an amazing community here in Singapore that works in that space. To kick things off, the work that we do is very complementary to the big data space. And the reason is the big data and population-based research field has really been critical in identifying which genetic abnormalities, for example, would lead to perhaps a specific drug being better for a person. That really takes big data to do. The question is, after that drug is identified for somebody, what's the best dose for a patient tomorrow? And for that very same patient, what's the best dose for them a week later, even a few days later? So in all of the fields of precision and personalized healthcare, I think we all broadly recognize that everybody's different from each other. Okay, that we know. But what's critical to note is that we are different from ourselves over time, which means the best dose for a person may be very different for that same person hours later, days later, weeks later. And so true personalization for us means it's a dynamic process. As the person evolves and changes over time, the treatment may need to evolve over time as well. And so what that means for us is we're able to use our Curate technology to calibrate everybody that walks in the door. We don't use pre-existing big data to train an algorithm that is then used to treat everybody. Instead, when a person walks in the door, we have no data on them. It's using only their own data to manage only their own care dynamically. And so we have to start from scratch, and we calibrate them with different doses of drug, understanding how they respond, and we make a digital twin essentially with that. And the beauty of this is that doctors themselves build the small data set that they themselves will use to treat the subject using only their own data. So for us, it's all about understanding that we change over time, and capturing that is essential to hyper-personalizing care.
How is that different from the way traditional medicine has approached treating patients? Maybe you can go specifically to some of the case studies that you mentioned or that you've used in the past, I think in the field of oncology. Mm-hmm.
Conventionally speaking, the word optimization has also been used differently between different communities. In the field of oncology, the word optimization, especially for things like dose, optimization tends to mean escalation. Okay, so if we want to optimize the dose, it means to find the highest possible dose a person can take. That's more of the traditional approach. But as we know, people change over time. And some people not only may not need the highest dose, some people may actually respond better at lower doses, but at the right time. And so, using our Curate platform and by developing these digital twins for users, we've had cases in the past where, especially in combination treatments, because the interaction between drugs is constantly changing, we were able to actually lower the dose for a solid cancer patient and actually increase the efficacy. So, you can imagine that when the traditional means of optimization is give the highest dose you can. But in this case, we showed that by lowering the dose at the right time, the efficacy was better. It really kind of did advance this notion that we could use the efficacy of treatment to guide dose change. Traditionally, it's been toxicity. Why? Because patients are getting the highest dose they can give. If you have to change the dose, it's always going to be lowering it because it's too toxic. We're lowering it to increase efficacy. It's a total paradigm shift. And it's for that reason how we ended up publishing our work in some of these major educational resources for clinical cancer doctors. A really different approach, but we've seen some quite promising outcomes.
What are some examples of that promising outcomes?
So, in addition to showing that we could lower dose to increase efficacy, something I think pivotal that we've seen with our work is this notion of synergy. Whenever people are using combination treatment, which is giving at least two drugs at the same time, there's this concept that you can achieve synergy by putting the two right drugs together at the right dose. But what we found with our technology is that synergy between drugs is dose dependent, time dependent, and patient specific. This is critical because any combination that is viewed as synergistic, which is a good thing, it's probably not going to be synergistic for every single person that gets those two drugs. And the reason is we're all different from each other. But for some of those patients, even though it appears that the synergy is not there, it doesn't mean it cannot be synergistic. And we showed that by tweaking the doses at the right time, we were able to see synergy in these patients. And we've done this for liver transplant patients to help prevent rejection of the organ, for solid cancer patients, including a prostate cancer patient, where at the right time, dropping the dose by about half actually improved the disease treatment outcomes. And the reason is everybody's changing. It's about finding that sweet spot. And because we're treating each person as their own discrete digital twin, we can do that.
When you're looking at medicine, you're looking at how you can give the right drug at the right time and the right amount. So it seems to me that when you're talking about big data, usually it's arriving at the right drug. And with small data, with what you call digital medicine, you're really looking at a better way to arrive at the right time and a better way to arrive at the right amount. I don't know if that's a fair characterization.
Yeah, your point really illustrates the importance of how complementary the two approaches are, because knowing which drugs to give is critical. And this is where the genomic medicine has provided huge impact. The question is, again, about how to give these drugs at the right dose dynamically. It all comes down to the type of data we need for the purpose. For some concepts like knowing which genetic abnormalities or mutations lead to a specific drug being preferred, we need a lot of data for that. And that's where our outstanding precision medicine community has been doing great work here. But we also would benefit from understanding within the same individual, once the drug has been identified, at what dose should we give the drug at the right time? And the type of data needed for that is not a lot of data. It's for this particular patient, if you give a high dose, how is the cancer marker? If you give a middle dose, low dose, switch back to middle dose, this dynamic change and monitoring their response to that is this kind of N of one hyper-personalized data set that's actually quite small. It could be a few data points. So it basically allows us to treat the patient more like an evolving story beyond a single snapshot of data. And so we've learned during our trials that we need the right data to do what we do. But it always does start by turning to our colleagues in the big data space to just tell us which drugs should we think about. We can help carry that forward by knowing how to dose them.
You're building some really interesting things here, which I think can only be possible in Singapore, in the sense that if you're looking at, say, the big and small data complementarity, you need to be very fast and agile. You need to be able to move quickly. So that's why there is a perk of working in Singapore. And now if you were to have a pitch to, the other technologists in your space, and you're trying to get them to work on big problems, and you want to get them to Singapore, what are the other points that you would make to them to come and work in Singapore?
There's so many. I think one of the first ones goes back to the concept of not having to operate chronologically. And I want to highlight that a little bit more. I think that when developing new technologies, we also have to think about things like clinical trial design and innovation in that space. I'll give you an example. So typically in clinical trials, a patient will be randomized. They get enrolled into the trial and they're randomized to get a low dose, a middle dose, or a high dose of this drug. If a patient does not respond to that high dose, they're typically removed from the trial, non-responder. And we'll never have known if this patient could have responded to the middle dose or the low dose. And we know this because when we look at some of the data that's pre-existing, and consulting with our clinical collaborators, much of that data doesn't exist for a number of the diseases. So this is where we differentiate. We allow each person to see the different doses. And that's okay because somebody's getting those doses. So these are safe and they're allowed. But just getting that little bit of extra information per person can give us more certainty of whether something's effective or not, or maybe what the best dose is for that person. I want to be clear that our goal is not to just go and wholesale low dose every patient. That's actually not the goal. Our goal is to find more responders. So that's the technical side. But back to the key question of the agility, right, of the ecosystem. There's a technology component here which allows us to find the right dose. But the trial designs that we use, the methods of how we analyze statistics, I think we need to think beyond our own echo chamber of our group. We need to speak to the regulators to understand if this line of reasoning is sound and if this data will be useful down the road for things like regulatory considerations. Instead of us kind of thinking, oh, this sounds pretty good, let's just run the trial, get approval for it, and see how it goes, we have the ability to speak to the regulators early. And I think that's alone a remarkable resource to have. And if we want to also understand things like, does our approach help to alleviate or reduce financial challenges for the patient? Because we might be finding lower doses. If we're finding lower doses, we might be reducing readmissions into the hospital. These are questions we can also answer in the course of this research. I remember in a recent conference I was at, when we think about optimizing outcomes, what does that really mean? In some cases, optimizing is just give the highest dose. Find that highest dose and give it and see if it works. But for us, it's find the optimal patient outcome. But what does that mean? And in our case, we're able to make it a multitude of definitions. Optimal efficacy of treatment, optimal safety, so lack of toxicity, and even try to optimize or reduce financial toxicity as well to the patient, of which when we think about the welfare of the patient, we can consider all of these elements because our ecosystem can help us answer those questions so quickly. So it's just about as multifaceted as we can get when it comes to answering the hard questions.
It really goes back to the idea of from idea rolling out to implementation. Singapore is, I think, a good place where you can compress your timelines, which I think makes sense. I think as a Singaporean, just looking out into the world, I think especially in the US, you have a federal system. You probably have very different approaches towards governance where you might have to go through different levels of clearance. Whereas like the good thing about being a city state is that you're relatively centralized, which helps.
Yeah, the rigor is there across all the ecosystems, but I think it's this agility. This is an agility that's truly remarkable.
You have this maximum beach readiness lifestyle. The interesting thing I wanted to ask was, Why are you not just doing this in the lab? Why are you treating yourself as a human experiment?
So, we've already talked about that people change over time. And I was intrigued to see if I change over time. And, after discussion with a friend, I looked up a bunch of solutions that are available over the counter. Such as a continuous glucose monitor for the arm, some finger pricking kits to look at blood glucose and blood ketones. Certainly, there are other things like wearables and watches to really understand when I do things like intermittent fasting, when I do things like lift weights or run, or try to look at different dietary interventions, how these can collectively serve as like a combination therapy to switch my own biomarkers and to understand how my own metabolism functions. And I kind of embarked on what I didn't know at the time would be this really interesting journey of understanding my own dynamics. And that's what led me onto this course of kind of this quantified self, this data exploration journey of my own digital health.
One of the big things you do is you do huge fastings, like you do like huge cycles of fasting. I wanted to ask, what has been the efficacy of fasting like for you?
The fasting journey for me began with a shorter fast. We're looking at something like a 16-8, which is conventional in terms of skipping one meal. Over time, I felt it to be relatively simple to undertake. And so I started lengthening them a little bit to 18-6, eventually to 24, and then eventually I started trying 36, 48, which is about once a month, and then on occasion, once a quarter, so I'll do a 72. And I also did this because I also wanted to understand dynamics of the biomarkers that I have, the lipids, the ketones, the glucose, over these longer fasts to see how they behave over time. And it was remarkable how repeatable these trajectories were, all the way to, how consistent these patterns were over time. And I just learned so much about myself during that process. When I think about how the fasting regimens have worked to my benefit, something that was really interesting was to look at a process called metabolic switch, which is our ability to switch between sugar burning and fat burning, also known as ketosis. This process has been studied for ages, but now there's an interest in understanding if metabolic switch behavior changes over the course of somebody's aging. And so for me, I use this as essentially a biomarker to understand when I fast, can it accelerate the switch, and what type of dynamics, what type of trajectory does that switch take? And something I learned was when I'm in ketosis, I'm effectively kind of, my ketones are high. And then when I exercise or lift weights, that releases sugar into our bloodstream. And so my sugar goes up, but ketones go down. And then as I wait a little bit, because I work out fasted, I can see my ketones on their own just rebounding back. And so what's remarkable there is to see the degree of control that we have over our own biomarkers just by the behaviors we choose to undertake. And I think that's remarkable because it's all back to behavior. If we choose to undertake certain healthy behaviors, we can actually see the payback very quickly. And I think part of my journey is to understand how can we use data and quick feedback to gamify adherence and healthier behavior. And that's what, unbeknownst to me at the time, I was able to do.
If I could ask a little bit more about how fasting has affected your performance, be it as a researcher, as an athlete, if I might call it, how do you see before and after? Do you see any difference in the way you performed?
First of all, I think that I work out fasted, and I think I have not seen any measurable decrease in performance. And if anything, I've actually seen improvements. One example that I often cite, actually two examples. One is grip strength, and the other one is things like push-ups, continuous push-ups. And there are charts where you can stratify yourself to a percentile. And from what I've seen in the literature, I am not in my 20s anymore, but the latest numbers of what I'm doing puts me in the 99th percentile for 20-year-olds. And I think that that has been an enlightening part. Another one is my running. I think running for me, I think for a lot of people, running isn't the funnest thing to do. But running for me has allowed me to kind of collect data to understand everything from heart rate variability to run times, etc. And I will say I'm probably running faster now for longer durations than perhaps at any point in my life. In terms of my actual biomarkers beyond ketones and sugar, I would say something that's been really neat for me is to see my numbers, like my lipids and other markers, better now than my 20s as well. And that's just not something I imagined would be possible until I started undertaking this journey. And people ask me all the time, so Dean, how long will you do this for? For until the next paper comes out? And for me, this is important. As we age, the definition of exercise, as we age, the definition of being healthy, the definition of what we should eat to kind of address the aging challenge, all of those definitions will keep changing over time. Over the age of 30, 40, needing strength training will matter more. Over the age of 30, 40, what constitutes healthy eating will evolve. And I think that has good outcomes. It keeps things interesting, it keeps things dynamic, but at the same time, it's a necessity. If we want to counter the challenges of aging, it's important to accept the dynamic nature of what defines being healthy is.
You eat quite healthy. I know you eat a lot of greens and you're very much on the organic path out, which is why I wanted to ask you, what would the specific health benefit of fasting be? Why would someone consider fasting?
I think it's important to note that, first of all, some people shouldn't fast. I think that it's critical if a person's thinking about undertaking fasting regimens to consult a clinician first who understands the space and the risks, if any. At the same time, also, people who are cleared to fast, there's going to be different regimens that work for different people. And there are many considerations here that are demographic as well. But you ask a great question, which is, if you're cleared to fast, what's the difference between kind of splitting meals up but eating clean versus eating, say, a clean meal but condensed into an eating window? And that'll go back to the goals of the person. In a matter of kind of eating clean and having a balanced diet, splitting the meals across is probably totally fine, right? Assuming it works for them and it's sustainable. The thing with fasting that I've actually seen with me is because I want to understand how my biomarkers respond. And so when it comes to getting into ketosis, for example, there's a couple ways to do it. One can undertake a keto diet, which is kind of this high-fat, low-carb diet. But I don't do that. I actually look at kind of a modified Mediterranean, if you will, which is not as high in fat, maybe higher in healthy fats, similar to Mediterranean, also very low-carb. And for me to kind of kick myself into the metabolic switch, I find that at least for me, the fasting actually accelerates it more versus kind of breaking meals apart. And I've done both. I've actually collected data across both spectrums. So if weight management and general performance are the ask of the user, it's probably okay to just split the meals up. But for me, I want to see that switch. And by monitoring that switch, for me, I find the fast jump starts it quicker.
So it's really more for the experimental outcome that you're designing for.
It's looking for that outcome and to see the gamification of the data switch. That for me is a great motivator.
What you talk about gamification and adherence, in the sense that as you gamify, you can find yourself maybe being more compliant with a diet or with a more healthier lifestyle. What are some ways that you've found to be successful or effective for yourself and maybe for your peers that you've given advice to?
A really important point. So something that's really of importance to us is to try to keep healthy people healthy. And at the end of the day, it's all about behavior. Because when we think about longevity and healthy aging, I think conventionally we often think more about the aging population, the seniors, which is critical, by the way. And a lot of our work is in that space. But at the same time, we know that young people are getting sicker earlier these days. So we do have an interest in understanding how we can help with modifying behavior in that segment as well. And so knowing that, we're trying to look for all kinds of ways to do this and to try to look for that population where instant feedback, with data or some type of incentive to show the person quickly that they're doing something good for themselves can be produced. So one way we're doing this is we're using things like generative AI, where if somebody's active, if somebody's out running, if someone's doing HIIT, high intensity training, if somebody is lifting weights, and you can see from their heart rate, which you can get from a watch, that they're active versus, say, being more sedentary. Generative AI, we've done a little bit of work already showing that with a variety of prompts, generative can produce images that differentiate between active and inactive people. And if we want to take it another level, it can be even animated. And so I think when we want to address healthier behavior, we want to kind of shy away from feedback that takes too long to realize. Which means if we tell somebody, hey, intermittent fast for 6 weeks, and by the end of 6 weeks or a couple months, you may lose a couple kilo. We think that a sizable proportion of that group may drop out. But if just by engaging in a healthy behavior like exercise and popping it into Gen AI, and it can produce an image that kind of rewards that healthy behavior through kind of what the image shows, the positivity, etc., will get people to stick with things consistently. One example, I took my own data, popped it into Gen AI, and my data from exercise yielded, with the prompt I used, which was Journey Through Space. And it actually showed 2 race cars zooming through this ultra-futuristic city. Then I took data of me sitting on a couch, and I put it into the same prompt, and it was an empty room. And I've done other prompts like dragon flying in the sky, and the data that's super active has this 3-dimensional fire-breathing serpent in the sky, and the inactive data was a tiny little 2D dragon pasted onto reprinting of my same data. Very different outcomes. And I think being able to kind of provide some degree of reinforcement with prompts that resonate, we can personalize to the user. Also with the mindset that even these incentives change over time for the same person, we're going to try to see if we can keep people healthy.
Using visual cues, and in a sense, it's positive affirmations in
Yes.
that sense to kind of further encourage the behavior. For you yourself, you've been on the journey, I think, even before the hype around AI, or before there was even like the widespread adoption of AI. So for you personally on your own health journey, given the fact that you're consistently experimenting on yourself, what are some of the major behavior shifts that you've seen yourself take in terms of getting healthier?
I think one of them was understanding the role of the eating window that I have and its impact on other elements of my life, like sleep. I used to eat an early dinner as my primary window, and then I ended up moving to lunch. And one reason was I wanted to start being a bit more comprehensive in how I look at my kind of regimen. And I found, and the data was quite instantaneous, that moving to lunch, which actually was always easier for me logistically, my sleep immediately improved. And so for me, I think the behavioral shift for me was being able to stick with these consistent eating windows. Sometimes, because we are dynamic, I will transiently shift to an earlier dinner and then go back to lunch, etc. But by and large, I've been able to stick with this for probably years now. And in parallel, while seeing the effects of the positive impact on my metabolism, it's allowed me to stick to the healthier, cleaner regimen of eating as well. It's quite clear that what we consume is critical beyond just fasting. I think that for me, I definitely don't use the fasting as a way to just eat super unhealthy foods. And I think that one kind of synergized off the other. Sticking with the regimen and seeing the impact and the performance improvements, etc., has kind of went over into helping me eat healthier and vice versa. And I've stuck with this consistently. I don't think that one can one can't use exercise to outdo a totally unhealthy diet either. And so this kind of synergizing between all of them has been a pretty cool outcome for me.
So say I'm a complete beginner and I want to start experimenting with improving my health, improving my fitness as well, what would you recommend? What are some of the first few steps that you think someone like a beginner should take?
I think the first thing to do is to go and speak to a clinician and to kind of get a broad overview of areas that can be worked on. After that, I'll let this mirror myself. I started small. The first thing that I did was to cut sugar out of my coffee. And I've said this before in the sense that starting small and then organically self-adding on additional parameters was probably the most effective thing for me versus constantly being told to just quit everything at once, for example. So taking sugar out of my coffee was followed. It was not easy, by the way. It took a few weeks at least to get used to it. Was followed by cutting milk out of my coffee. So it really became a kopi o kosong, right? And that's in my paper, by the way. I published a paper on myself and the term is in there, right? To show a localized context. And then after that, I actually really did feel better. And it wasn't that easy at first, but once I really started feeling better, I started paying a little bit more attention to the other sugars that I was consuming daily. And I'm a little bit older now than I was before. And so being a bit more mindful of my own metabolism and, needing to be careful. So slowly removing some of the things I probably didn't need was a good way to start. The other thing that really helped me was putting on one of the continuous glucose monitors for two reasons. The first one is to understand the role of diet on blood sugar. In this case, it reads from the interstitial fluid. But the second one, which I did not expect, was the ability for this monitor to see the sugar release from lifting weights. It was actually an immediate marker for me being good in a gym and doing something good for myself. And that instant gratification, that immediate feedback was game-changing for me. And so starting small, removing some of the things we don't need, but doing it slowly because it's not going to be that easy in the beginning. And then eventually pairing it with some type of feedback to let someone know they're doing the right thing.
It's really interesting because I think a lot of people have this like big declaration, like the New Year resolution, right? And then what happens is that in 3 weeks' time, the adherence just falls off. Whereas for you, it's really about stacking small wins and then compounding those habits. And one of the things you talk about is localization. In Singapore, it's like a food haven. It's known for good food, but the food might not be good for you, right? So in terms of diet, how do you actually encourage or how do you actually get people to eat more healthily in Singapore?
I totally agree. I mean, one of my great joys is having chicken rice. And I thought to myself, how do I keep this as part of my regimen? Because we have to keep things fun, right? Keep things sustainable. So what I'll do on occasion is, by the way, one of the best parts of chicken rice is the rice.
Yeah.
And so what I'll do on occasion to kind of gamify my ability to keep it into my regimen is I will have chicken rice without the rice, okay, which kind of is not optimal for sure. But I still get the chicken. I still get the veggies. Put some of the chili sauce on there. No rice. I'm a little sad. And then once I've kind of had a certain number of iterations without the rice, let myself have some rice, right? A little bit of a light at the end of the tunnel. I think that thinking about different creative ways to look at maybe some different ingredients that can still respect and honor the amazing food culture, but might be able to slightly modify the nutrition profile could be helpful. We're starting to work with some of our FNB partners in the community to look at maybe things like monk fruit sweetener and maybe elements where olive oil can be introduced or avocado oil. Small changes. We're not there yet, but we're getting there. But I think that moderation is okay. I think that if we look at moderation in the great foods that are here, coupled with, if appropriate, some fasting, coupled with sustainable fitness regimens, coupled with maybe some looking at sleep regimens as well, I think we can coexist really well together. The food culture is amazing. And one thing we are quite clear on is to not just exit all the enjoyable foods because we have to be happy too. So our goal is to not cut everything out. It's really about how do we introduce them and have them in the regimen in a manageable way so that we can actually keep enjoying them as long as we can.
Talking about exercise, just now you talk about exercise and diet. I wanted to ask you, if you had to have a constraint on your fitness routine, meaning you only have like 7 exercises that you have to do for the rest of your life, what would the 7 be?
Fantastic question. The first one would be push-ups because I think that push-ups are just a really good and accessible exercise that works shoulders, triceps, chest. You even get some back in there, legs, core, the whole thing. And I think they're doable by basically a broad population. I think standing squats, even without the rack, are helpful. I think that crunches done with good form can help. Some people prefer planks. I think I'm at 3 or 4 right now. I think that seated dips are also pretty good I'm at 4. Okay, shoulders, etc. Maybe some lunges. Again, with or without weights, pretty good. I think some degree of walking. Okay, I think we'll call walking running if you want to keep them same or separate. Walking, I think, is a great exercise. We know about getting our steps in. But I like walking in particular because it's something that can easily be done as a family, with friends. It can be done outside to appreciate the amazing nature that we have here. Something that I think is critical is breath work because that's, again, something that anybody can do. I think that comprehensive health and stress management are important. I would actually add maybe yoga. I think something that is important to know is that flexibility is also strength. And over time, I think if you look at everything I've mentioned so far, we've covered strength, we've covered cardiovascular, but flexibility matters too.
I like how those are infinitely scalable. So you can start from 0 all the way to
Yes.
to 1,000, right? I wanted to ask a little bit about the breath work. By breath work, what do you mean? Because I'm not actually very familiar with breath work.
So there's a couple ways to do it. When we look at things like there's a concept or an approach known as box breathing, which is used by everything from firefighters to any other profession that may be a high stress environment. And there's different iterations of it, but the concept is kind of taking 4 to 5 seconds to inhale, holding it for 4 to 5 seconds, 4 to 5 seconds to exhale. And the measurable impact this can have on slowing heart rate, on relaxation, on de-stressing, it's something that is actually used by a number of sectors to address kind of the de-stressing element. And I think that for those interested in data, those who might need rapid feedback on real outcomes, it's something that is quite as clear as day. If someone's got a wearable on, looking at the heart rate and doing things like box breathing, whether to start the day, whether to end the day, and there's actually many methods of breath work can be really important. Especially we live globally in a high stress, multitasking under financial challenges every day, family challenges, work challenges. Being able to have truly accessible and methods that can be practiced anywhere on an airplane, 5 minutes before walking on stage to give a talk, 5 minutes before going into an important meeting. These are things that really can help people focus, de-stress, and perform. I'll tell you, there's a very popular thing in Singapore now and elsewhere, such as ice baths, right? Cold plunging. I'll mention that provided a person has been approved from a medical standpoint to do these, breath work for something like that will be essential. Proper breathing and being able to kind of tolerate and really maximize any benefit from that, how one breathes matters. And you know what? For sports, for certain things like jiu-jitsu, for things like everything from basketball to tennis and beyond, we know that breathing the right way will be essential for proper endurance and performance. And I think that the more that we can prioritize even a little bit of time to look at possible ways of de-stressing, breath work could be a very powerful way.
One of the last questions that I had was more on the rise of interest in biohacking and what we call biooptimization. You yourself, you take a very scientific approach towards it. I know you prick your fingers all the time, monitor your own glucose level or your own ketone levels. And one of the things that has really intrigued me is, how should the average consumer who's not in that space kind of approach media in this space? Because sometimes people might think someone like if you were to think of an example, would be someone like Andrew Huberman, right, in the US. I think a lot of people very inspired and they have very deep interest in improving their performance through his media. But at the same time, some of the people say that, hey, some of the studies that you cited, they're actually quite ambiguous, they might not be the most appropriate for someone to just try on their own. So then it begs the question of how can the consumer be more literate in that sense in consuming media with regards to health. So this is where I wanted to ask you as a professor, as a teacher as well, how can you give us some guidance on how we can be better consumers of media in the health space?
I think there is a ton of content right now with regards to hacking and health optimization, etc. And I think the first thing to consider when looking at all this content is that whenever somebody gives some sort of advice out, I think sometimes the public is looking for kind of the most direct and easiest route towards an answer. There are notions of eating meat only, carnivore diet only, or notions of avoid all plants, drink only this type of juice, etc. And I think what's challenging is the broad consumer is wanting actionable advice. So maybe they're a little bit less interested in someone saying, oh, there might be a right regimen just for you, but we're going to need time to figure out what that is. I think people want answers quickly. So I think something important for this is for people to avoid jumping into the first thing that they hear that might be the easiest for them to try. That at the heart of it might be quite challenging. I think if someone says, eat this food only for the next 6 months, that's a direct and clear route. I think that really digging deeper is essential to make sure that some of these recommendations don't harm their health. Bottom line is, I think social media has put us in an unprecedented path where people don't need laboratories anymore to conduct experiments. And the challenge is, a lot of the reagents are easily accessible for this. They can go to an online supplement shop and buy a bunch of supplements and just immediately start trying. They can go to their supermarket and buy ingredients and only eat that ingredient. And yes, while there are influencers who have made science more digestible for the masses, which can potentially be helpful under the right context, we right now have a lot of kind of absolutism. Don't do this, only do that. Eat this only, don't drink that. I think people need to take a moment and really try to understand what is safe for them. That can include, for sure, having a talk with a healthcare provider and going over some of the options first before they embark. Just because somebody says so online with maybe a brief flash of a journal paper reference, it not only doesn't make something necessarily an absolute guaranteed in terms of health improvement, but it can be dangerous. And I think it's important for us to be evidence-based. It's important for us to be safe. And it's important for people to know that it's okay to take the time to sort out what is right for them. And what's right for them will change over time, likely. And that's what makes it interesting. But kind of these crash course, absolute, eliminate this, only do that, the chances of that being truly optimal for the person who hears it may not be very high, right? So I think one of the greatest gifts and resources a person can do for themselves as part of a health optimization journey is to do a little research, do a little understanding alongside a medical provider to make sure that they know the repertoire they have to work with and go about this in a disciplined manner.
With that, Dean, I'd like to thank you for coming on the show.
Thanks for having me.